The Ragon Institute actually started as an experiment. Could we bring together scientists, engineers, and medical doctors, pool their untapped knowledge and creativity, and create an environment of cross-disciplinary collaboration to tackle the greatest global health challenges of our time? Our vision was bold: to harness the immune system to prevent and cure human disease.
The precursor to the Ragon was a small HIV lab, which Bruce was running over at Mass General. At that time, Bruce was building a lab at the University of KZN at the Nelson Mandela School of Medicine.
Bruce ended up meeting Terry Ragon and Susan Ragon through this company that was doing the electronic medical record for a hospital where we were providing HIV care before the treatment came to the country.
Not surprisingly, Terry got more interested in the crisis himself as he started engaging with Bruce Walker, and he and Susan, with vision and generosity, in 2008-9, created what is now the Ragon Institute.
It was really critical that this be a collaborative institute. So we decided that what we would do is make this a joint project involving Mass General, MIT, and Harvard. The diseases that we study are HIV and TB and influenza, COVID-19, malaria, autoimmunity, and cancer.
Really having a patient-centered, patient-first approach to how we design and implement the science is one of the things that distinguishes the Ragon Institute. FRESH is a program that enrolls adolescent girls and young women, and during that time, they have very frequent HIV tests. Integrated along with the testing and monitoring and sampling is an empowerment class.
It is a human immunology institute kind of at its core, but I think what's really differentiating and defining, what definitely drew me, I think drew a lot of my students, is that focus on global health.
What attracted me most to the Ragon is the collaborative nature of the institute. All of the scientists are coming in with disparate backgrounds and strengths.
And I think the Ragon Institute has done a very good job of recruiting engineers, microbiologists, computation-oriented people, and traditional immunologists. And I think that bridging of interdisciplinary science with that mission statement with flexible funding creates an environment that is hard to replicate.
Where can you find places that you can literally knock on your neighbor's wall and say, I have a question, and they have an actual insight?
Being in a place where fundamental scientists and clinicians are brought together and where everyone's ideas are respected is really unusual.
The Ragon has really invested in young scientists. They're very committed to continuing that training process, but enabling individuals to start doing that research at the same time.
It helped me to not be afraid of tackling difficult problems and to really get my research to a higher standard.
It's a commitment that people in science take to bring up the next generation. The RISE program is our summer internship program. We bring in high school students and undergraduates from across the region. PRISM is a partnership with MIT, and we put them in labs and they work with a mentor.
It's not who we are, but who we are going to be. And those young people that we have are going to be really the game changers of what is going to be the Institute in the next 50 years.
Where we go from here is to continue to enable scientists and clinicians and engineers to do innovative work that's high risk but potentially high reward, always with a focus ultimately on the patient and having an impact on patients' lives.
This is the real gift that Terry and Susan have left us. They've left us an institutional structure that can carry on for the next 50 or 100 years and longer to address issues that aren't going to go away so easily.
I'm really thankful that they kind of give us the ability to make science fiction a reality.